We're just filming kind of like an improv chat with Dennis. And Dennis has been a patient of mine since I really began practice back in Florence, South Carolina. I think, Dennis, if we're correct, that it was probably like 2014.
Probably earlier than that. If I remember correctly, in 2011 is when I started to see Dr. Carter, and I think about a year after. So I don't know if it was around that time frame.
So Dennis was one of my first patients, and I graduated chiropractic school in April of 2013. So it had to have been just after that. But so
I think so.
It went all the way back to my first year in practice, and I'm just now here we are later. It's October 25th, 2022, and I've just been blessed with the opportunity to continue to be one of Dennis's providers and healthcare practitioners, and we just had an amazing visit today. So we're here in the mobile DMX truck. We have digital motion x-ray. We also have ultrasound that we just did on Dennis. But basically, I hadn't seen Dennis for probably over 2.5 years. And he's gone through a lot of trauma, especially this year. And so, he came in today, and I wish we would have taken a photo of him when we first came in, because he was carrying his head lower, and I could tell something heavy was on his heart. And we ended up getting him into a pretty good place today. Do you want to tell us, how did it go today?
Well, I'm so impressed with this new method of treatment. Like we discussed earlier, when I came into to your practice here, I was wondering, well, how this is going to go. But I trusted that it was going to go well, because in the past you've always been a very caring person, and you always look for the root cause of the issue, and so I am pleasantly surprised with this new method of treatment, which is instant. I'm feeling so much better now. It didn't even take a few hours. It just within a few minutes I'm feeling so much better. So I'm happy that we were able to reconnect today.
Thank you. So some of the things that we did with Dennis today were, we first took a lateral x-ray, and after we took that lateral x-ray, we did an adjustment. And we'll show you the images that his curve improved significantly with one adjustment, using both the Impulse IQ and also the Laney instrument for the upper cervical adjustment. So after we did that, we checked his jugular veins again, because we found earlier, before adjustments, that on the left, it's completely closed. Like he has to do a full Valsalva to open it. So he's bearing down and it opens a little, but then it just disappears. So after the adjustment, the vein hadn't changed that much, even though the curve in the spine was perfect. It was completely better after the first adjustment, right?
Yeah, I feel so much better. It's so hard to believe.
But the interesting thing is that we actually had to do the weight therapy afterwards. So you think, oh my gosh, the curve is perfect, just leave him be, he's great. But his brain still wasn't draining correctly. So we went ahead and we fit him for weights. We'll show you the pictures, where he actually wears a 5-pound. It's, I call it the Hutcheson reverse weight, because, I think that we first started using that one, and then it's folded twice, hanging off the back of his neck. And then he has an 8-pound chest weight. And for Dennis, with that combination, it was the thing that opened up his internal jugular vein on the left. When he had him on, he felt better. He felt like, hey, this isn't that, it's heavy, but it feels right. And the curve looked good. We checked the curve that we'll show you also with the weights on. So through today's visit, which was very comprehensive, we spent well over an hour together. We were able to not only get his mobility perfect in all ranges of motion, he's touching his toes when he bends down. He feels lighter, less head pressure, the posture's improved. And we found a therapy that he can do at home now daily to get those veins open while improving the curvature and really strengthening it and rehabilitating it there. The reason the weights work is we're resetting the muscles to hold the body in the right position. And a side effect of having a really good spinal curve is that it helps your blood flow, because the bones can impinge on nerves, on blood vessels when your neck's in the wrong place. So when we have it in the correct spot, everything works better. And Dennis, thank you so much for continuing to be a patient, and I'm just really grateful for today's visit.
No, and thank you, Brian. This has been a life-changing moment for me. Like I said, I've always trusted your good judgment, and right now I feel so much better, and it only took a few minutes. So thank you.
You're welcome. Okay, thank you as well.